Hi, I'm Dr. Karim Kaladi. I'm your clinical and sports psychologist and sleep specialist. Welcome to our channel, where we dive deep into the complexities of mental health and well-being. Today, we are tackling a topic that affects countless lives: panic attacks. These sudden, intense episodes of fear can be overwhelming, making you feel like you're losing control, or even facing a life-threatening situation. But what exactly are panic attacks? Who is most at risk? And what happens if they go untreated? Most importantly, how can we manage them effectively? Let's explore these crucial questions together. Panic attacks are sudden, severe episodes of fear or discomfort that can strike without warning. They can cause a range of physical symptoms, including heart palpitations, shortness of breath, dizziness, chest pain, sweating, and trembling. In severe cases, people might feel like they're suffocating, losing control, or even dying. These episodes typically peak within 10 to 20 minutes, but the effects can linger for much longer. Many people mistake panic episodes for life-threatening diseases like heart attacks and seek emergency medical attention. It's important to note that 1 or 2 panic attacks can be a normal response to high stress. However, when these attacks become frequent and unpredictable, it could be a sign of panic disorder. Panic disorder involves recurring panic attacks and a persistent fear of future episodes. This constant anxiety can lead to significant behavioral changes, like avoiding situations that could trigger an attack. Such avoidance can be disabling, sometimes leading to agoraphobia, which is the fear of leaving home or being in crowded places. Panic disorder is a mental health condition that often develops in late adolescence or early adulthood, with women being twice as likely to experience it. While the exact cause isn't fully understood, it's believed to result from a combination of genetic, biological, developmental, and environmental factors. Some researchers suggest that panic attacks may be a misfiring of the body's fight or flight response, occurring in situations where no real danger is present. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, panic disorder is characterized by the abrupt onset of at least 4 of the following symptoms: a pounding or racing heart, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, chills, numbness, choking, detachment, or fears of losing control or dying. These symptoms must not be linked to substance use, medical conditions, or other mental health disorders like social anxiety or obsessive compulsive disorder. And if panic attacks occur over 1 month, it may indicate panic disorder, especially if they are recurrent, unexpected, and distressing. Let's now explore some of the key risk factors that make someone more likely to experience panic attacks. Firstly, certain demographic factors play a role. Women, younger people, and those with fewer economic resources are more prone to panic attacks. These factors create a backdrop where stress and anxiety can easily take root. Psychologically, certain traits make a difference too. If you tend to experience negative emotions, are highly sensitive to anxiety, or avoid new situations, your risk goes up. These factors create a heightened sensitivity to stress, making panic attacks more likely. Family history is another significant factor. If you have a family history of anxiety disorders or panic attacks, you're more likely to experience them yourself. Genetic factors can make the nervous system more sensitive to stress, increasing vulnerability to panic attacks. Chronic stress is a major contributor. Prolonged exposure to stress depletes the body's resources for managing anxiety, making panic attacks more likely. When stress becomes chronic, the risk of panic attacks increases significantly. Trauma and PTSD also play a role. Individuals with a history of trauma, especially those with post-traumatic stress disorder, PTSD, are at a higher risk of experiencing panic attacks. The brain's heightened sensitivity to stress can trigger panic in response to certain cues or memories. Neurochemical imbalances are key too. Imbalances in neurotransmitters like serotonin, dopamine, and norepinephrine can make the brain more prone to panic attacks. Conditions such as depression or other mood disorders often play a significant role in these imbalances. Physical health can also influence your risk. Chronic illnesses, particularly those starting in childhood, and conditions like joint hypermobility syndrome have been associated with increased vulnerability. Medical conditions like thyroid disorders, cardiovascular diseases, or respiratory conditions such as asthma can mimic panic attack symptoms and trigger actual panic attacks. Life events and environmental factors are critical too. Stressful experiences like trauma, major life changes, or substance use, including caffeine, nicotine, and alcohol, can act as triggers. Withdrawal from these substances can also contribute to panic attacks. Poor sleep quality, insomnia, or intense fatigue increase the likelihood of panic attacks. Early experiences also matter. If you had separation anxiety or generalized anxiety as a child, your risk for panic attacks later in life is higher. Early onset panic attacks themselves often lead to future episodes and can be linked to other mental health conditions like bipolar disorder. There are even biological factors at play. Some people have abnormal responses to certain physical stressors, like inhaling carbon dioxide, which can indicate a predisposition to panic attacks. Personality traits and thought patterns are also significant. Individuals with a tendency toward catastrophic thinking, or those who are highly sensitive to bodily sensations, are more prone to panic attacks. Low self-esteem, perfectionism, and high expectations can contribute as well, as these traits often lead to increased stress and anxiety in challenging situations. Finally, other mental health conditions can increase your risk. Panic attacks often occur alongside depression, OCD, and other anxiety disorders, complicating treatment and making recovery harder. Now, let's talk about the consequences of untreated panic disorder. Without treatment, panic disorder can lead to severe mental, physical, and physiological consequences. It can result in the development of comorbidities such as depression, generalized anxiety disorder, agoraphobia, and social isolation. The constant fear and anxiety can increase the risk of suicide due to despair and the feeling of being trapped by recurring panic attacks. Physical health consequences include cardiovascular issues, respiratory dysfunction, and gastrointestinal effects. The physiological and behavioral consequences include hypervigilance and chronic stress, which can weaken the immune system and lead to conditions like hypertension and metabolic diseases. Substance abuse can also occur as individuals may turn to substances in an attempt to self-medicate, further exacerbating both mental and physical health issues. Untreated panic disorder can significantly disrupt daily life, leading to decreased productivity, absenteeism, and social strain. Fortunately, panic disorder is treatable. If you or someone you know is experiencing panic attacks or has been diagnosed with panic disorder, it's crucial to seek healthcare help early. Early diagnosis and treatment can prevent the condition from worsening and can improve quality of life. However, diagnosing panic disorder can be challenging, as its symptoms often resemble those of other illnesses. This can lead to misdiagnosis and delays in treatment. In some cases, individuals develop a delusion that they have undiagnosed medical conditions, leading to a lifetime of unnecessary suffering. This is why support from friends and family is so important. Feeling isolated can exacerbate symptoms, so open communication, self-education, and encouraging loved ones to seek professional help can make a significant difference. Treatment for panic disorder typically involves a combination of medication and psychotherapy. Antidepressants or anti-anxiety medications may be prescribed to help manage symptoms. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for anxiety disorders. CBT helps patients understand and change their thought patterns and behaviors. It involves educating patients about panic disorder, teaching them to monitor their symptoms, developing breathing and relaxation strategies, which are the most effective physiological ways of calming anxiety levels, addressing catastrophic panic attack beliefs, and progressively exposing them to fearful circumstances. In addition to formal treatment, lifestyle changes can play a vital role in managing panic disorder. Regular exercise can reduce stress and anxiety, decreasing the frequency of panic attacks. Good sleep hygiene is also important, as sleep disturbances can worsen anxiety and panic. Avoiding caffeine, alcohol, and refined sugars can help as well. Practices like deep breathing, mindfulness meditation, and progressive muscle relaxation can reduce anxiety and help prevent panic attacks. When it comes to helping someone or yourself during a panic attack, understanding the underlying issues is key. Panic attacks often involve two critical components: death, anxiety, and outcome control. These components are typically reactive and cause significant distress. Research suggests that panic disorder is influenced by these factors, and psychotherapy can be effective in exploring a patient's psychological history, addressing these underlying issues, and ultimately leading to emotional stability and fewer panic attacks. Help someone else or yourself who is experiencing a panic attack. The most crucial thing is to remain calm. Reassure them that the attack will pass and help them focus on slow, deep breathing. You can also guide them through simple exercises to keep their attention on their surroundings. Instead of saying calm down, acknowledge their feelings and offer support. If possible, move them to a quiet place. Encourage them to seek professional help if they experience frequent attacks, and stay with them until the panic attack ends, which usually takes between 5 to 20 minutes. Thank you for joining us on this journey to better understand panic disorder and panic attacks. If you or someone you know is struggling with panic attacks, remember that seeking professional help can make a world of difference. For more information on anxiety disorders, including panic disorder, and to hear personal stories from those who have experienced it, be sure to watch our video on anxiety disorders. Stay informed, prioritize your mental health, and remember that help is always available.